Okay, we're going to start the nursing assessment for the respiratory system. We're going to cover the assessment for both upper and lower respiratory system. When we talk about respiratory problems, we're only going to discuss upper. You will do lower respiratory issues in the fall. So let's start with just a few things about the respiratory system. A little bit of it is review from AMP. The primary purpose of our respiratory system is gas exchange. We transfer oxygen and carbon dioxide, or the CO2 component. It is divided into two parts, upper and lower respiratory tract. So for your upper respiratory tract, you do have the nose, the mouth, the pharynx, the epiglottis, larynx, and the trachea. When we talk about the lower respiratory tract, we're talking about the bronchi, bronchioles, alveolar ducts, alveoli, and the lung actual lobes. There's a couple of terms that we need to go over: bronchoconstriction and bronchodilation. This refers to the decrease or increase in the actual diameter of the airways that is caused by contraction or relaxation of the muscles. Oxygen and carbon dioxide actually exchange, and they exchange in the alveoli, so that's extremely important. The other thing is we need to know that deep breathing promotes air movement through the pores, and it also assists with moving out any kind of mucus that we have in those bronchioles. Bacteria can also move into those particular pores, which would end up causing an infection. A few other things that I want to talk about is surfactant. Surfactant is a lipoprotein that lowers the surface tension on the actual alveoli. It reduces the amount of pressure that is needed to actually inflate the alveoli. This is special because it's less likely to have your lungs collapse, so that's extremely important. If you don't have enough surfactant, the alveoli will collapse, and this is actually called atelectasis. Post-operative patients are at risk for atelectasis because they have anesthesia, which can cause this decrease in surfactant. The other thing is they usually are restricted with breathing because they're in pain, because it's a post-op patient, they're going to have pain. The other thing that happens, or where someone could have atelectasis, is someone who is in acute respiratory distress. They will also call this ARDS. And this is the lack of surfactant, and this also is one of the causes of a lack of surfactant. The other thing we need to talk about is blood supply. You have pulmonary circulation. This provides the lungs with blood that participates in the actual gas exchange itself. The pulmonary artery receives deoxygenated blood from the right ventricle of the heart and delivers it to the pulmonary capillaries, and they're connected with those alveoli. Then we have the pulmonary vein that returns oxygenated blood back to the left atrium, which delivers it to the left ventricle. Then the oxygenated blood is actually pumped out by the left ventricle into the aorta, supplying the arteries and the systemic circulation. So that's just a little quick review of how the blood is filtered and processed. This goes back to the cardiac chapter, so if you have any questions, your cardiac assessment chapter actually has some really good pictures of blood flow of the heart. The other thing we need to know is that fluid drains from the pleural space by lymphatic circulation. So there are some times where conditions can cause accumulations of fluid, and this is something called a pleural effusion. You will see a lot of times when you are in the clinical setting, patients are admitted and have a chest x-ray, and one of the interpretations would be atelectasis or pleural effusion. If they actually have pus in the pleural fluid, it's called empyema. These are sick little cookies when they have empyema.